Johnson has been urging people to exercise extreme caution and personal responsibility when legal controls to limit the spread of coronavirus end in England on Monday. But in an exclusive YouGov poll for Good Morning Britain, we have found 57% of people are worried about coming out of lockdown.
So, is the Prime Minister right to trust everyone to make their own personal judgment and for us to trust each other to keep ourselves safe? Well, Kira Durkin has been hearing what the country might think about Freedom Day.
As usual, I think Boris Johnson has got this completely wrong. No, it should not be left to us. It should be implemented as a rule. Masks must be worn and social distances must be kept.
We all want our freedom, but is it the right time? I'd love to think it is.
We need our lives back. No masks. We need to be able to breathe.
Until they're really 100%, I would think they should be taking it really quite easy and easing into it slowly and surely, more than just let's get everyone out free into the world.
We are grown-up adults. We should be able to manage everything in our lives. I think we have to learn to live with COVID. So I do think that Freedom Day, that's it. We all have to decide what to do from there for ourselves and for our own families.
Well, joining us is broadcaster Afia Adom, who says people can't always be trusted to do the right thing, and journalist Isabel Oakeshott, who thinks we need to get back to some kind of normality, and the time is now. And Dr. Amir Khan joins us in the studio as well to talk about this. Good morning to all of you. Thanks very much for joining us. Afia, let's start with you, because just explain what your concerns are, because, you know, we heard from there that people are worried, but there are other people who think, do you know what, now is the time to learn to live with it and to move on with the rest of our lives?
I mean, my concerns are really about the numbers at the moment. We have 48,000 new infections, just over 48,000 new infections yesterday, and just under 70 deaths. Now, we've got infections at the highest rate that they were since autumn 2020. And yes, we've got less deaths. And yes, we have less hospitalizations, but cases are on the rise. And yes, I 100% agree that, you know, Freedom Day is a concept that I want to get behind, that it would be great to be back in nightclubs and back in stadiums and back out there. But I do think that we need to have an air of caution around this time. I think masks and social distancing are something that should stay for a while until numbers are down. A third of the population are still unvaccinated, haven't had both of their vaccinations. They're mostly young people. And we know that young people can have just as much organ damage from COVID as people over the age of 50. I think we're on a precipice at the moment. And it's a time where we need to be sensible and take things slowly. There's people who are immunocompromised. There's people who are pregnant, who can't necessarily get the vaccination, and there's people who don't want it. And I think there's a lot of people who are still at risk. And I think now is the time to just have some caution.
Isabel, Dr. Amir Khan is with us now, and you were saying, weren't you, that we're the first country, aren't we, to lift restrictions in this way. Why do you think it's right that we throw caution to the wind, whip up our masks and go out into the world? Why do you feel confident that's the right thing to do?
Well, I don't think anybody is suggesting throwing caution to the wind. There's no denying the quite stark figures that are coming out. But with reference to masks in particular, you know, you're asking whether we can trust people to do the right thing. I don't think it actually matters very much if they don't do what you're depicting to be the right thing, because masks make virtually no or even no difference whatsoever. Now, of course, medical grade masks, the type that are used in hospitals, are a different thing. They are effective, but there is no evidence whatsoever that the type of face coverings people are wearing are actually effective at all.
We have got some research.
What's your view on that? We just he might have some evidence. We just got to bring him in.
There was a Cochrane review looking at all the data for face coverings and masks, and it did overall say that face coverings were protective against respiratory viruses.
Now, what is Isabel's point is that people are using all sorts of things. Is that related to the medical ones or the ones that, you know, we buy from
overall face coverings overall? This was looking at the review of a number of studies, and it does show that they are effective in conjunction with other social distancing measures. But I think now, when we're looking at lifting restrictions, my argument would be don't do it all at once. Don't open up the nightclubs, do open up the nightclubs and get all that sorted, but don't lift the mandate on wearing masks, because they are effective at reducing transmission.
So, Isabel, why do you think there's no evidence then that they've helped?
Because there is vanishing little evidence. Doctor, I'd be interested in whether you have looked at what's happened in California and Texas, where they've taken radically different approaches to masks. And when Texas dropped their mask mandates, the governor of California described that as incredibly reckless. When you actually look at the data as to what happened afterwards, both states, with their very different approach to mask wearing, tracked around the same way. Virus numbers dropped in any case. So, these masks are symbolic in all the wrong ways, I think. They are symbolic of repression. They perpetuate fear and anxiety. And, look, if it made a difference, then by all means, I'd be very happy to wear one. But they don't make a difference. I don't know about the study that you're producing. I think it's highly questionable.
Okay. Well, listen, that's your opinion that you don't think they make a difference. We have got some other information here from Surrey University. Researchers there found that well-fitting three-layered cloth masks can be as effective as reducing the transmission of COVID as surgical masks. But setting aside the issue of masks themselves, do you think, with the situation we're in, with cases on the rise, hospitalisations on the rise, that this is the right time to relax all the restrictions? As we've heard from Professor Chris Whitty, he says we're not out of the woods yet. It could mean that we have further lockdowns as a consequence.
We're not out of the woods, but we're certainly not going to have further lockdowns as a consequence of people not wearing masks. And I do feel I need to pick you up on this study that you cited, because it talked about three-layer masks. Nobody wears those. Look at the interview that you did on the streets that you broadcast just a minute ago. Half of your interviewees were wearing their masks slung under their chins. That's how the reality of it works. And the Prime Minister has said, if not now, when? And he's absolutely right about that. Everybody who is vulnerable has now been vaccinated. We have got to move on. This virus, or rather our response to it, is actually crippling our society.
Yeah. OK, and I want to bring back, but what about the idea of the mask as a signal? People might be not following the rules exactly at the moment, and I think there has been an emotional relaxation.
Just to point out as well, can I just say, because those people that we saw in our report were outside when they were wearing masks as well, so it's a different situation.
They're not, that people don't sometimes wear it properly anyway.
No,
so what about it as a signal, though, that if people think they're not wearing the mask, the next thing is the distancing isn't the same. The next thing is the other thing isn't the same, and it's a slippery slope, isn't it?
So I think that's a really good point. And if you look back to what the World Health Organization and the government itself was saying up until summer last year, they too were arguing that masks made very little difference. And then they changed their guidance for political reasons. That's been evidenced. And so you're right that to a large extent masks are symbolic, but for me I think they're symbolic in the wrong ways. We do not need to keep perpetuating this state of fear and anxiety. Just look at the state we're in as of today, with the NHS app pinging so many people that businesses can't function, and the NHS, which we're supposed to be protecting here, is simply unable to deliver routine care in many cases because so many people are needlessly self-isolating. We can't go on like this. We just can't.
I mean, Afia, how would you respond to that with the situation that businesses have been in and the fact that, one of the lines from the government has been, if not now, then when to relax restrictions?
I think when it comes to the NHS Test and Trace app, obviously there are issues with that need to be sorted. And I'd like to think that's more of a techie IT thing rather than, lots of people actually contracting the virus. We're hearing of people who, their neighbours are being pinged through the walls because one person has the virus, the person next door is being pinged, but they may not have been in contact. But that also shows, or could also show, how much the virus is in circulation. And if we keep certain measures in place, like social distancing, like hands face space, like wearing masks, then perhaps we can keep those numbers down. Yes, I understand the sentiment of if not now, then when, but we have to look at what happened in the Netherlands, for instance, that opened up. Lots of people felt far too early on the 26th of June. They've had a six-fold increase in numbers. Work from home orders are coming back into place. They've reshut nightclubs, restaurants and bars because of what's happened, because of such a huge uptick in cases. Nobody wants another lockdown. Nobody wants to be back to where we were in January of this year. But numbers are on the rise. Like I said, yes, deaths are lower. Yes, hospitalizations are lower. But lots of people still have the virus. Yes, we have to learn to live with it, but we don't have to get to a state where the virus is running out of control. Yes, we want to get things open, but let's have some measures in place while we do that, slowly but surely, to get to a place where we can stay permanently open and permanently in some state of normal must be better than us going back into another lockdown.
OK, well, Afia, Isabel, thanks very much. Let's finish with a word with Dr Amir, because obviously, you know, there's a lot of strength of feeling, isn't there, on this subject? And I think there are those people that are worried coming out of restrictions, what that will mean. There are others that are keen to get back out there. Do you think in general that people's fear of, you know, the threat of another lockdown, the possibility of another lockdown, could encourage people to be more cautious about this?
I think everything we can do to encourage people to wear masks, and there is a lot of evidence that masks work in reducing the transmission of respiratory viruses in conjunction with other measures, social distancing, test and trace, yes, but there is real evidence that they do work, and we've got to be very clear about that. You know, we're calling it Freedom Day on Monday. For a lot of people, it's not Freedom Day at all. We're taking away their freedoms if they're clinically extremely vulnerable, adults or children. We've got to be really mindful of that. I'm not a lockdown zealot. I want to make that really clear. I do want to come out of this lockdown as much as anyone else, but only when it's safe to do so.
And, of course, Scotland, Wales and Northern Ireland have taken a different view.
Yeah. The right
and
view,
a more
I would
cautious
say.
one.
Yes, you know, they are slowly easing their restrictions. They're keeping masks in place in indoor and spaces and public transport, and that's really, really important. This virus, you know, we talk about social distancing. We talked about earlier people working in shops and them being at risk. This virus is transmitted airborne. It lingers in the air for hours. So if you're working in a shop, if you're a ticket inspector on a tube perhaps, and this virus, people getting in and off, and this virus is lingering in the air, you are at risk. So please wear a mask.
For others.
For others as well. Leanne's got in touch to say that she works in a supermarket and she's really worried about it. She said there's been little consideration for staff, and she's worried about whether people are going to continue to wear face masks or not, and what the risks for her will be as a consequence.
Yeah, and the only way face masks work is if, you know, yes, you have to wear it properly, yes, you have to wear the right types, but also the more people who wear it, the more effective they are. So that's the key. You know, if we make it voluntary and less people wear them, they're less effective overall.
And also you get a downward spiral of people thinking, well, no one else is.
Yeah.
OK, well, look, good to talk to all of you this morning. Thanks very much indeed.